Good afternoon, folks. This is Robert Chappell, Executive Editor of Madison365, with your daily update for April 8th. I am not sure that my audio is working. There it is. That's better. No, it's not. All right. We'll do the audio this way. Why is this not working? All right. If you can't hear me, comment and say so. But I think it's working okay. So first, what I want to do is mention that the show today is sponsored by Forward Theater Company, which presents Lewiston Clarkston by Samuel Hunter, a two-play experience that follows descendants of the famous explorers who struggle to forge their own legacies in the modern American landscape. This virtual theater experience is streaming online April 9th through the 25th. Tickets available at forwardtheater.com. One other thing I want to plug is the Men's Leadership Summit coming up next week, Wednesday and Thursday. It's all day. They're virtual, so you can come in and out, check out the schedule, and take a look at those sessions that you want to attend. And it is free. Registration is required. And this is just one of the panels. This is a panel basically about education, but the idea is, how are we preparing young men of color for a future where the system built to oppress them, basically, and they have how are we teaching them ideas of masculinity, all that sort of thing. So Joe Maldonado there on the upper left he's an alder from Fitchburg and an entrepreneur and a community leader, and he's going to moderate this panel, which will include Jack Daniels III, president of Madison College, David O'Connor from the State Department of Public Instruction, and Carlton Jenkins, who is the superintendent of schools in Madison. One other thing I want to mention about the Men's Leadership Summit before we get to the COVID news, which is very bad, is that Quartz Health Insurance is a sponsor of the Men's Leadership Summit. Quartz offers access to high-quality healthcare and innovative wellness programs to help people live healthier. The company strives to provide exceptional service by valuing the unique insights, perspectives, and cultural backgrounds of their employees and the communities they serve. At Quartz, the customers are at the center of everything they do. Visit them at quartzbenefits.com, and they and other sponsors, Quartz and many other sponsors that have come in to support the Men's Leadership Summit, help us make it free. Like, we were going to originally charge $49 to come to that summit, and we don't have to charge anything at this point because we've got basically the cost covered by those sponsors, and we appreciate that very much. Now let's talk about COVID stats, which are, it's hard to even say it's a mixed bag at this point. It's just kind of bad news today. For the first time in a long time, we have over 1,000 cases today. I don't think we've had 1,000 cases in a day since January, maybe. We're reporting of those new test results today. We've got 5,846 new test results. Of them, 1,046 are positive. There's just no nice way to say that. We try not to get hung up on the number of cases because it's about trends and it's about positive test rates and that kind of stuff. But over 1,000 cases when we've been much lower is bad news all around. But also the positive test rate, the 7-day positive test rate is up again at 3.8%, getting close to 4%. We need that to be below 3.0. I've been saying that for months. Got to get that positive test rate to below 3.0, right? It is now 3.8, which is just not good at all. It's very bad, in fact. And I'm not sure exactly why. and I'm not sure exactly what to do about it other than tell you again, keep your mask on, keep your distance, avoid those big events, avoid indoor gatherings, avoid eating in restaurants indoors. You still go to your takeout and stuff. It's just things are not looking good right now, despite vaccinations continuing to accelerate. Here's the thing. The fact that we have vaccines rolling out right now, the virus does not stop spreading as soon as one person gets vaccinated. Okay, we have now 1.25 million people vaccinated in Wisconsin, fully vaccinated, like both shots done. 1.25 million people. That's a lot. That's great. That leaves well over 4 million people unvaccinated. It's at least 3 million of which have never been infected yet. It's a lot of vulnerable people. You might be one of them. Let's stay vigilant. It's going to take us at least 3 more months to get everybody vaccinated. And we saw what happened in 3 months from June into September last year. At the end of June, things started to go up. We all let our guard down. Things started to go up. And by September, we were in full-blown crisis mode. We don't want to be in full-blown crisis mode by July when we're trying to get people vaccinated. Okay? Public health officials have to concentrate on vaccination right now. We cannot hand them a bunch of COVID cases. Okay? Let's all be good. Let's keep our masks on. Stay distant. Stay vigilant. Let's not travel yet. Now, on the vaccine front, though, the news is good. We're almost 22% of the population is vaccinated fully. We've given almost 3.3 million shots have been given. A good portion of the Madison365 team has had at least one shot, or is getting. A couple more of us are getting shots. Three members of our staff are getting shots today. So we're trying to do our part. So you get your shot, and then you can volunteer and help other people get shots. But if you're in that position where you can get an appointment, grab it, do it, get it done. We're seeing if this number is right, I'm a little surprised this is really high, but 90,000, almost 91,000 shots given reported in the past 24 hours. That's amazing. We're going to get this done. It's just going to take a couple more months. We just have to hunker down for a couple more months while this gets done. I know you're impatient. I know you feel like everything's fine because it's nice out and there's vaccines. It's not fine yet. It will be very soon. Okay. One other number I'll mention, 14 deaths reported today, which is not catastrophic, but it's more than we've seen in the past couple of weeks. Last time we saw a number that high was March 20th, so almost 3 weeks ago. And again, death is a lagging indicator. So with these, increase in cases today, we will see an increase in deaths 3 or 4 weeks from now. It's possible because most of the older folks have been vaccinated. It's possible that a lot of these cases are in younger people who are less vulnerable. So maybe the death rate among this cohort of cases will be slightly lower. But still, of those 1,000 people that got tested positive today, it's a real reasonable possibility that 10 of them won't make it. The 10 of those people we're talking about, this 1,000 cases are real human beings, 10 of whom will be, I hate to say it this way, but 10 of whom might die in the next month. That's where we are. That's not good, right? There is still a pandemic. We are beating it. We are winning at this moment with vaccines, but we haven't won yet. We can't let up. Okay. All right. That is my soapbox for today. We'll take a short pause, and we have lots more news to talk about on the other side of the break. Don't scroll away. I will be right back.
Here in the Midwest, community is important. Having a healthcare system that's looking out for us.
That's actively addressing the racial disparities in healthcare is important.
When we can get good quality care, we can do more. We can achieve more.
We can be the kind of community we want to be, and that's really important.
UW Health. Remarkable medicine. Remarkable care.
All right, so I should acknowledge I was late today because I had a meeting for a project that I'm going to be able to announce probably next week, and I'm very excited about, and you will be very excited about it too. But also, when I came on to do this, Facebook was down. So I don't know if you've noticed that Facebook was down for some period of time. A lot of people were upset about that, and I was like, I know you enjoy your Facebook, but I actually need Facebook to do my show. So I had to sit here and stare at Facebook's error message for 10 minutes until I could get up on here. Okay, there's a story today at Madison365.org. Our main feature this morning is about this program called Own It, building Black wealth. And this is a home ownership program. The idea being is one thing to kind of teach people how to be homeowners, and another thing to actually help them do it. So this is, and also recognizing that generational wealth is a real thing, and the wealth gap is a real thing, right? There's disparity in income between white and black people, but even the bigger gap, and the more pernicious, and the more pervasive, and the more destructive gap is the wealth gap. Because when your parents own a home and have assets like that, and your grandparents as well, you start life with just a foot forward. You're a step ahead already when you start. So these folks, Sarah Alvarado and her real estate group, are trying to sort of help people overcome that and lay down wealth for subsequent generations. So what it is, it's like you take classes and stuff, which is kind of part of a lot of these things. You learn about financial stuff, whatever. That's one thing. But then they give you $15,000 for a down payment. So the classes and the sessions are going to be in the summer of 2021, this coming summer, and then the money will be the following in 2022 is when you can actually look at actually buying your house. So it's innovative, it's ambitious, it's in partnership with One City Schools, and it looks really cool. So check that out. It's on Madison365.org right now. All the information on that. Also today, Ford Madison announced today that they will return to Breese-Stevens Field. Now, given all the numbers I just gave you, I have mixed feelings about this. Okay, I know that the club cares about the community a lot, and they are really pushing vaccines because they know that their livelihood depends on our ability to gather as a big crowd. That's literally the Ford Madison, the professional sports revenue model depends on people gathering in large groups. So that's why Fort Madison is really like, we need you to get vaccinated so you can come watch our games, so we can have big crowds again. So they're going to start out. The current health order is there's no limit on outdoor gatherings as long as every household can maintain 6 feet of distance from every other household. Right? So you're not going to have 5,000 people in the stands at Breese-Stevens Field. You're going to have a family and a family and a family. So they're thinking. It sounds like they're hoping when they start the season, May 15th is their first home game. They'll have something like 1,500 to 2,000 fans in small little households bunches. I don't think they're going to be able to do like concessions or anything, which is another big source of revenue. I just don't know how they would do that. Maybe they'll be able to in a limited capacity. And then hoping that as vaccines roll out and, maybe by June, things will be good enough that they'll be able to kind of get up toward like 50% capacity. But it's exciting for the community. It's exciting that they, because last year they played all their home games in Wauwatosa, and I never even made it to a game. So it's exciting for them. It's exciting for their fans. It's exciting for the community. And I'm confident that they'll manage it in a responsible manner, and there's also evidence that outdoor events, generally speaking, are relatively safe anyway. And I know the fans and stuff too. They're gonna be cool about it. Also today, I would recommend to you this interview with Janine Edwards. If you go to our YouTube channel, you can see this Real Talk with Henry Sanders interviewing Janine Edwards. She's an entrepreneur and a diversity and inclusion consultant, and just a real, community mover and shaker in Milwaukee, and has a ton of interesting things to say about her own past, her own faith journey, but getting married as a relatively public person, and sort of getting married recently, and sort of gender roles and all sorts of interesting things. It's about an hour conversation. But if you go to our YouTube channel, you can watch it. Or if you are a podcast person like I am, you can get the audio version wherever you get podcasts. Just search for Real Talk with Henry Sanders. You got to put the with Henry Sanders on there because, believe it or not, we weren't the first to think of naming a podcast Real Talk. In fact, we were about the 1,000th, I think. There are many other podcasts named some form of Real Talk. So if you go to your podcast app, your Stitcher, your Spotify, your Apple Podcasts, whatever you use, just search Real Talk with Henry Sanders and you'll find it. And it's a terrific conversation. I highly recommend it to you. That is all I have for you today. I don't know what else to say, but keep your masks on. Keep your distance. Stay home. It's almost over, and I want it to be over, and you want it to be over. We all want it to be over. We've wanted it to be over for 6 months. For more, what am I saying? We've wanted this to be over since it started, and it's almost over. Just got to hang out a little bit longer. A couple of more months. We've been saying that for a long time, but now we can really say it because we know the vaccines are here, and they work, and they're real. So get your shot if you can. And until then, keep your distance. Hope you have a wonderful evening, and we'll see you again tomorrow.
This is 365 Media.